Good morning. Today I am discussing about hyperproteinemia. So there are three different types of proteins in the blood. If you see there is albumin, globulin and fibrinogen. This protein is absent in serum. So simply if you want to calculate globulin, you can easily calculate based on the total protein value minus total protein minus albumin. So this is how you calculate globulin. So uh, if you see the values of total protein in case of greyhound, you found low values. So low values as compared to reference values for dog, right? And before uh, evaluating the hyperproteinemia, we should rule out the pre-analytical causes of artifactual hyperproteinemia. Artifactual means not real, not actual. What are those pre-analytical issues? These could be lipemia or hemolysis. If there is increase in lipids in the blood, so that will artifactually increase the value of protein in our results. So before evaluating the real hyperproteinemia, you should rule out these causes or pre-analytical issues, right? So if you see, there are two types of hyperproteinemia. Number one is hyperproteinemia. There are two types of hyperproteinemia: relative and absolute. Relative means it is due to hemo concentration. It is not real. Relative always relative means not real. Absolute means it reflects the actual picture. So relative hyperproteinemia is seen in hemo concentration, or we can say that dehydration. So in relative hyperproteinemia, you observe the increase in albumin as well as increase in globulin in blood report, right? You observe increase in both parameters, and you also see increase in PCV or increase in erythrocytosis or RBC count, because there is dehydration. So all the parameters got increased because they got concentrated. Albumin get concentrated, globulin get concentrated, PCV or erythrocytes RBC gets concentrated, because there is a loss of fluid from the body, right? But in anemia you may observe normal level of PCV in case of relative hyperproteinemia. In case of anemia, you may observe normal PCV. In absolute hyperproteinemia, you observe the increase in globulin level and decrease in albumin level, right? So this is the main difference, right? This is the actual hyperproteinemia, absolute, right? There are there are acute phase proteins like CRP, C-reactive protein, serum amyloid A, SAA, haptoglobulin, right, ceruloplasmin. These are acute phase proteins. They got increased right, during inflammation or infection. So when electrical field is applied, various proteins, depending on their size, their shape, their charge, they will move, right? They will move from anode to cathode, right? Some proteins settle in this region, some settle in this region, some settle in this region. Acute phase, so there are different regions: alpha region, beta region, gamma region. So acute phase proteins, they settle in alpha region, right? APRs, they settle in alpha region. So basically, and immunoglobulins, uh, they settle between here, beta to gamma region, right? So basically, why we evaluating electrophytogram? To rule out the cause of hyperglobulinemia, to rule out the, or to evaluate the pathogenesis of hyperglobulinemia. So globulin increased in particularly two type of disorders. Globulin increase in particularly two type of disorders: in inflammatory infectious disorder, inflammatory or infectious disorder, neoplastic disorders, right? So basically, uh, during these processes, these disorders, hepatocytes, liver cells, they reprogram, and they will shut down the production of albumin and increase the production of globulin, right? So these disorders, neoplastic disorder, inflammatory or infectious disorders, any type of infection, either biometra, either any suppurative infection, either fungal infection, any hemoprotozoal infection, any bacterial infection, they, or any inflammatory problem like some immune mediated diseases like SLE, systemic lupus erythematosus, SLE, or immune mediated polyarthritis, any immune mediated diseases, they cause inflammation. So they will start this process. Hepatocytes, they reprogram, right, and they shut down the production of albumin, and so that's why I said in absolute hyperproteinemia you find increase in globulin and decrease in albumin, because hepatocyte shut down the production of albumin and increase the production of globulin. So basically what happens is, immune system or immune system that so depending on the various proteins, various globulins, they settle in the various region in the electrical field or electrophytogram, right? So basically immune system that reacts to organism. It could be bacteria, virus, or any early child, anything, right? It react to organism, and it will cause the cloning of lymphocyte plasma cells, right? And these plasma cells, they produce antibodies. These antibodies, they are specific to particular antigen. So in most of the infectious or inflammatory disorder or neoplastic disorder, polyclonal antibodies are produced because these organisms, they have various antigens, and against each antigen there is separate antibody, right, or there is specific antibody. So that's why there is cloning, polycloning, right? So there is, but in monoclonal gammopathy, this is a polyclonal gammopathy. In infection or inflammation or neoplasia, you would see polyclonal gammopathy. polyclonal gammopathy. I will show you the electrophotogram, right, of these gammopathies. In monoclonal gammopathy, what you see, basically there is cloning of single particular cell. So suppose this is a cell, so cloning produce multiple clones of this similar to this cells. So these cells, they produce antibodies. What type of antibodies? These are monoclonal antibodies. These are monoclonal antibodies. So this monoclonal gammopathy you observe in CLL, chronic lymphocytic CLM, chronic lymphocytic myeloma, or you observe in leukemia, you observe in lymphoma, you sometimes observe monoclonal gammopathy in ehrlichiosis also, or leishmaniasis. So various electrophotographs we will discuss of these gammopathies. Like if you see the normal electrophotogram, you see there is increase in albumin and right. This is a normal protein electrophotogram. Normal protein electrophotogram. In polyclonal gammopathy, what will happen? So there will be decrease in albumin as compared to normal. There would be decrease in albumin, and there are different types of antibodies. There are different because in polyclonal, I told you different clones of different cells are there, right? So these clones, they produce different antibodies. So there would be a wide base and irregular this region you would find in polyclonal gammopathy electrophotogram. Polyclonal gammopathy electrophotogram, you would see this region like this, wide and irregular, because various proteins have different various type of proteins are there, different size, right? So they will accumulate, they will settle down depending on their size, their charge, right? In polyclonal, you observe the clonicity of different cells, right? Many cells, clonicity of many cells. But in monoclonal, you found decrease in albumin. This is a globulin portion, right? You would find decrease in any gammopathy, polyclonal or monoclonal, you found decrease in albumin as compared to normal. And you find, because in monoclonal most of the all the antibodies have same size, so they accumulate at a particular point. So you see a narrow based electrophotogram. You find this region narrow based, right? So this is a monoclonal. So these have very important role. Treatment depends on the underlying cause. So thank you very much.